How does your running form cause common injuries? Imagine running with a smooth, efficient motion that feels natural and easy. Now picture how tiny flaws in your technique can turn that smooth ride into a painful experience. Your running form is like the blueprint for how your body handles the thousands of foot strikes you make during each run. If your mechanics are off, even slightly, it can cause stress on your muscles, joints, and bones that adds up over time. Every step you take involves repeated impacts, about 1,000 foot strikes per mile, so small issues can lead to bigger problems if not addressed. When you run, your body absorbs shock through your feet, ankles, knees, hips, and lower back. If your foot lands too heavily or in the wrong way, it can overload certain tissues. For example, overpronation, which is when your foot rolls inward too much, can cause abnormal pressure on your knees and shins. This often leads to runners' knee, shin splints, or iliotibial bend syndrome. On the flip side, oversupination, where your foot doesn't roll enough, can put extra strain on the outer leg and the plantar fascia, leading to plantar fasciitis. Poor knee alignment is another common issue. If your knees collapse inward during each stride, it puts extra stress on the kneecap and can cause pain called runner's knee. Weak hip muscles or poor tracking can make your knees turn inward too much, increasing the risk of injuries like iliotibial bend syndrome. If your hips tilt or move excessively side to side, it can cause torsional stress on your lower limbs, leading to shin splints or stress fractures. Overstriding is a big problem for many runners. When your foot lands too far ahead of your body's center of mass, it creates a braking effect and increases impact forces. This can lead to stress fractures, Achilles tendonitis, or plantar fasciitis. Heel striking with a heavy impact can also send shock waves up your leg, stressing bones and joints, especially if your cadence is too low. A cadence of about 170 to 180 steps per minute helps reduce these forces. Core and pelvic stability are often overlooked but are key to good running form. Weak core muscles can cause your pelvis to tilt or wobble, leading to uneven load distribution on your legs. This imbalance can cause overuse injuries like tendonitis or stress fractures. Maintaining proper alignment through strengthening exercises for your hips, core, and legs helps keep your mechanics in check. In sprinting, explosive power and quick turnover are essential. If your form involves excessive heel striking or lateral trunk lean, it can increase injury risk. Distance runners should focus on consistent cadence and avoid overstriding to lessen impact. Regular gait analysis can identify faulty movement patterns so you can correct them with targeted exercises or orthotics. Paying attention to your running mechanics and making small adjustments can prevent many injuries and keep you running comfortably for years.